accessibility of healthcare. Very particularly, getting a Canadian to talk to a healthcare provider that can actually do something for them, that can actually treat them or triage them or measure them or assess them and get them care in ways like, do they need a diagnostic device? Do they need a medication? Do they need a referral to some healthcare practitioner that can actually get them care? The whole system in Canada in terms of healthcare is completely broken. And it's no one's fault in some ways because our population density has just gone insane. We cannot graduate doctors fast enough, and doctors are at the top of the hierarchy. But over the last couple of years, nurse practitioners, physician assistants, pharmacists have all been able to assess and prescribe patients for things called minor ailments in Canada. In the US, this is called pharmacist prescribing, expanded scope. There's different names. No one cares about the names. The point is, patients can get access for things like menstrual cramps, acne, birth control, diabetes supplies. We have millions of diabetes patients who are on diabetes medications, but they can't even measure their glucose level because they have to go through some antiquated process from 20 years ago to get access to like test strips and needles, and it just makes no sense. What we've all missed, all of us have been sleeping on this because we don't have a choice. Like, your whole life you have been told when you're sick, go to the doctor. And what we are doing at MedEssist is like there's a pharmacy on every single block in the whole goddamn world. It can transcend geography, it can transcend language. You could go to Spain tomorrow, not speak Spanish, right? But you'll see the cross with the snake and you're like, hey, I can get healthcare there. You don't even know what the healthcare is. You don't know if it's like an injection. You don't know what capacity that country allows that pharmacy to do things, but you recognize it because you've been taught that I can walk in there and get, medication for a headache, whether it's Panadol or Tylenol, whatever it is. You don't even know the name of the brand or what the thing is, but you know you can get healthcare there. And that's super cool. Now, the problem is traditionally, technology in healthcare has been a bug. And what I mean by that is that every other industry, if you and I got a job tomorrow, if we lost jobs in our careers right now, and we changed careers and got some random new job, the technology would follow us. We would use things like Google Docs for slides and Canva for videos, and our phone apps have these like phenomenal capabilities that would let you and I start a new job tomorrow really easily. If you were in healthcare, the technology you're using is literally from 20 years ago, 40 years ago sometimes. It's ridiculous. But we expect these healthcare workers to take care of us and get world-class care, but then we give them absolute crap to work with. It makes no sense. I think even if they hire top talent to work for them, there is so much healthcare burnout that they would never have the guarantee that this person that they've just hired is happy in their role, is not going to leave soon. There's a lot of healthcare burnout. And the difference that they can bring to that environment is arming that new candidate with something that actually helps them do their job, because it shows them that you care about them. You can do everything in the world. You can give them the best salary, the best benefits, but if you put them in this work environment where they can't even do their job properly and they're so stressed about it, like a healthcare worker's job or like whole mindset is to solve the patient's problem. But if they can't do that, they're going to be unhappy. They're going to leave soon. They're not going to show up as themselves at work. And it's so broken. And if you really care about someone and the people that are working for you, you allow them to do their job at their full capacity.